We want to make sure that our patients understand how to correctly use their inhalers. For this exam, you will be required to be familiar with the correct use of a meter dose inhaler. Please refer to page 100 of your textbook, box 10.5. It goes over the correct use of a meter dose inhaler. I want you to review the information in the entire box, but there's a couple things I'm going to point out here. So when the patient's using the inhaler, you want to instruct the patient to take a slow, deep breath through the mouth, and during inspiration to push the top of the medication canister once. Once they breathe in or inhale that medication, the patient is to hold their breath for 10 seconds, then exhale slowly through pursed lips. If a second dose is required, wait 1 to 2 minutes and repeat the procedure by first shaking the canister in the plastic holder with the cap on. So that's a big thing you see patients doing incorrectly is if they're using 2 puffs, they do them back to back. And what they need to do is do 1 breath, 1 puff, hold their breath for 10 seconds, slowly exhale through pursed lips, wait 1 to 2 minutes before doing the second dose of the same medication. If the patient has 2 different medications, this is another important thing to know in order to teach our patients. If let's say they have a bronchodilator like albuterol, and then they have a glucocorticoid inhalant also, they want to use the bronchodilator or the albuterol first, and then wait 5 minutes before using the inhaler that contains the steroid. So albuterol will always be the first medication inhaled, and that helps open up the airway so that second airway can travel in deeper into the airways and do its job. So albuterol is always first, and a 5-minute wait if there's different types of inhalants being used. On your textbook, also in your textbook on page 101 there and figure 10.8, there's a picture of a woman using a spacer. So just so that you're familiar with what spacers are devices that are used to enhance the delivery of medication from a meter-dosed inhaler. And then another term you may hear in regards to administering medication to the airway is a nebulizer. A nebulizer is a device that changes a liquid medication into a fine mist or aerosol that has the ability to reach the lower, smaller airways. So what is sinusitis? It is inflammation of the mucous membranes of the sinuses. A systemic or nasal decongestant may be indicated. Acetaminophen, fluids, and rest may also be helpful. For acute or severe sinusitis, an antibiotic may be prescribed. Acute pharyngitis is inflammation of the throat or a sore throat and can be caused by a virus, beta hemolytic streptococci, or other bacteria. A throat culture should be obtained to rule out beta hemolytic streptococcal infection. If the culture is positive for beta hemolytic streptococci, a 10-day course of antibiotics is often prescribed. Saline gargles, lozenges, and increased fluid intake are usually indicated. Acetaminophen may be taken to decrease elevated temperature. Antibiotics are not effective for viral pharyngitis. So we're at the practice questions now. If you want to pause the video, read through the question, pick your answer, and then resume playing to hear if you indeed picked the correct answer. So for question 1, the correct answer is C. For question 2, the correct answers are A and B. For question 3, the correct answer is D. For question 4, the correct answer is C. For question 5, the correct answer is A. For question 6, the correct answer is D. And for question 7, the correct answer is B.